Sawadika, very good evening and welcome to Thai PBS World Tonight. I'm Nabunag.
I'm Tulip นักสมภพเรา
And today, almost 5,000 new COVID 19 infections were recorded. And this is the highest number ever recorded in Thailand since the start of the pandemic last year. And among the new infections, we have to give them a big mention here because most of the new infections that were recorded, more than half of them are inmates in prisons across the country. So over 2,800 of them were inmates in prisons, as announced by the Corrections Department last night. The department stated that the virus has spread inside prisons due to the admission of new prisoners, including prisoners who have been escorted to and from court hearings, whereas some of them may have contracted the virus outside the prison. And this raises the cumulative total of infections in the latest outbreak beginning in April to almost 65,000 already, while the total since early last year is now 93,794. Meanwhile, the CCSA spokesperson, Dr. Tawisin Wisnuyotin, also mentioned the COVID 19 situation in Bangkok because undeniably, apart from the inmates, there are still infections from clusters in Bangkok, notably the cluster infections in Klong Toei, Pathumwan, and Suan Luang districts, where the numbers have not slowed down, and at the same time, the number of severe cases are increasing. And so far, over 6,000 people in Bangkok are currently confined in compulsory home isolation, while 226 others are quarantined in hotels. Meanwhile, the Bangkok Metropolitan Administration reported today that 1,146 out of almost 27,000 people living in the Klong Toei slum have been screened since April 12th, and that 1,100 people have been tested positive for the disease. But besides that, the results for another 5,000 people are still pending. So we can see that there are the clusters here. We are seeing more infections, but the big number that we're seeing is mainly half of it's come from the prisons.
Well, it's alarming anyway because this is we can say that the new number, the new infected case today, the numbers just double the usual number. I mean, double the highest one that we got so far because it's over 4,000. Now, talking about the infection in the prison cells, the one of the protest leaders that has been released like several days ago, Rung Panusaya, she just announced yesterday that she was infected with COVID-19. And today, the corrections department denies that she got infected in the prison. The correction department said that the anti-establishment protest leader, Panasaya Sitti Jawatanakul, did not contract COVID-19 in detention after she announced her infection yesterday. According to the Deputy Director General of the Correction Department, Wirakit Han Paripan, Panasaya was in quarantine between April 23rd and May 5th, and that, he said, 100% active screening has been conducted in the Central Women's Correctional Institution where she was held. He also said that Panasaya did not go outside the prison or engage in any activities before she released on May 6th. 100% active screening was conducted again on May 8th in the zone in which Panasaya was quarantined. Also, no inmate who stayed with her had COVID-19. Another detained protest leader, Panupong Maichatnok, whose COVID-19 result was positive today, just the announcement today, has been sent to the corrections hospital according to the officials. So 2,835 inmates are reported to have contracted COVID-19 in two Bangkok prisons. That is a big number from two places. According to the department, all of them have been sent to hospital, while some family members have been contacted in accordance with each inmate's wishes. The Correction Department Director General Ayut Sintapan has said that there will be COVID-19 testing in prison every week, adding that prisons with a large number of infected inmates can seek permission from the governor and their local health authority to set up field hospitals within the prison compound. He also said that the department is proceeding according to the Public Health Ministry's guideline, including the bubble and seal practice for prisons with a large number of infections, reducing the number of new inmates, testing new inmates before and after court appearances, or opting for teleconference hearings. Also, some prison officials have been instructed to work from home, reduce physical contact with their families, and are required to undergo swab tests every 2 weeks. Meanwhile, it has been confirmed that the lawyer of key anti-establishment leaders, Noraset Nanongtum of the Thai Lawyers for Human Rights Center, has been tested positive for COVID-19 as well. He just announced that on his social media today.
Right, and now let's move on to the issue of COVID 19 vaccines. There has been rumors that there is a double taxation on the vaccines, which were imported by private sectors. And recently, the Revenues Department has refuted an allegation that it has imposed double taxation on those vaccines that were imported by the private sectors, resulting in higher charges for inoculations. Somai Siri Udom said, the spokesperson for the Revenues Department and Tax Collection Strategic Advisor, claimed that the double taxation allegation is misleading and inaccurate. She said that although the vaccine importers are required to pay 7% value added tax, they are eligible to have that refunded or can deduct the VAT paid from their sales tax. When the importers sell the vaccines, they impose a 7% sales tax, but this sales tax can be deducted or refunded, she said, adding that only 7% value added tax is charged, not 14% as widely understood. So the Revenues Department has clarified that that 7% can be deducted when you actually purchase them.
Okay, so now we're still on the subject of vaccine, but it's a question of there's a lot of people that still feel hesitant whether they should take vaccine or not, COVID-19 vaccine, because they might not like the brand, or they just don't know enough, or they're afraid of side effect, or they hope that they can get different brand. So the question is to get vaccinated or not, and the experts said the answer should always be yes. And Rama channel has sit down the several number of experts, medical experts together to give you an answer of why the answer should be yes. So how dangerous is the vaccine? Dr. Yongpu Warawan, a renowned virologist from Chulalongkorn University, said that crossing Bangkok's Silom Road is still riskier than receiving a COVID-19 vaccine, despite reports of side effects. I think that can give you a very clear picture. Professor Dr. Kunkanya Chok Paibulkit from Mahidol University's Faculty of Medicine, Sirirat Hospital, backed that up with statistics, pointing out that nearly 2 million people have been vaccinated in Thailand with no fatalities. In comparison, between 1 and 2 in every 100 COVID-19 patients in Thailand die daily from the virus. It is therefore clear that going without a vaccine carries a far greater risk, especially since hundreds of new infections have been recorded every day this month, but like today, 44,000 something. So what are the side effects? Dr. Kunkanya said that up to 1 in 10 recipients suffer mild side effects like fever and swelling at the injection site. Only 1 in 100,000 people develop more serious side effects like sores, which disappear within a week. She said that not to be afraid, nobody dies, this is her word, becomes disabled or develop permanent health conditions from COVID-19 vaccine so far. For extra reassurance, there will be trained staff on hand at all vaccination stations to ensure people suffering from side effects receive timely help. So, what about blood clots? Blood clots is something that we hear in the news in the past several months now. Professor Dr. Pantep Angchai Suksi, who teaches hematologist at Mahidol University Faculty of Medicine, Ramathibodi Hospital, said that COVID-19 vaccine does not increase the overall risk of blood clotting disorders among Thais. However, in the West, there have been a few unusual cases of blood clotting accompanied by low levels of blood platelets and after the vaccination. And he added that generally Thai people risk of developing blood clots is about 10 times lower than Westerners, probably due to the genetics. So he also said that those infected with COVID-19 have a greater chance of developing blood clots than those who have been vaccinated. So far, there have been no blood clot related incidents among Thais who have received a COVID vaccination. So, what are the benefits? Can't believe that we still have to talk about the benefit of the vaccine. But yeah, Assistant Professor Dr. Kamthorn Malatham, the president of the Infectious Disease Association of Thailand and lecturer at the Faculty of Medicine Ramathipati Hospital, said that the risk of getting infected is halved soon after taking the COVID shot. Protection rises further after the second shot, which is required for the AstraZeneca and Sinovac vaccines currently available in Thailand. He added that getting shots protects not just the recipients, but also those around them, helping to restore normal life after the crisis. Associate Professor Dr. Tanyavi Puthanakit, the deputy head of the pediatrics at Chulalongkorn University's Faculty of Medicine, said that the COVID infection is now rising among children. That is alarming, with as many as 100 admitted to King Chulalongkorn Memorial Hospital alone. So adults can help protect children by achieving herd immunity, she said. To reach that goal, about 70% of the population must be fully inoculated, according to the scientists. 70% mean 50 million people. So that's a lot. It means if you in a family of five, at least 3.5 of you, which is like 2 people or 4 people, should be vaccinated. And if like 2 of them are kids, 3 of you just have to get vaccine just to make sure your kids also get protected as well.
Definitely. So to sum up, basically, it's better to be inoculated compared to going outside and risk of contracting the virus, because many of the medical experts say that it's even safer than walking on Silom Road. That's really
Yeah,
interesting here.
if you have a question about efficacy of this vaccine, the worst case scenario is 50%, which is as much as flu shot. Flu shot is something people take every year, and it's reduced the chance of getting flu. This is the same thing. It will help reduce the chance of getting infected with COVID-19, which if you get infected and you already vaccinated, there's a chance that you get infected even though you're vaccinated. You would, there is less likely chance that you will develop severe symptoms. So having vaccinated is better than none anyway.
Sure. And now let's move on to another issue. We just mentioned that many of the dense communities have become hotspots for new COVID 19 infections. And the pandemic has highlighted many of the underlying problems, such as the financial issues, and many children have been lacking in nutrition, education, and some even experience domestic violence. Not only the fact that they are at high risk of getting infected with COVID 19, but the pandemic has highlighted these problems even more. So let's find out more in this report.
อยู่บ้านอยู่ชุมชนนี้ป่ะคะ
ไม่
ริมทางรถไฟนี้ป่ะ
ใช่ค่ะ
อ๋อซื้อมาจากไหนอะ
ฮะ
เอามาจากไหน
แม่ให้มาขายช่วยแม่ขายของ
อ๋อช่วยแม่ขายของแม่รับจากบักทองเหรอ
ใช่ค่ะ
ขายกี่โมงถึงกี่โมง
ก็บางครั้งก็ขายถึง6 โมง
อ๋อแล้วตำรวจจับปะเนี่ย
ไม่ค่อยจับค่ะไม่เดี๋ยวนี้ไม่ได้จับแล้ว
อ๋อเมื่อก่อนจับเหรอแล้วช่วงนี้ปิดเทอมเหรอคะ
ใช่ค่ะ
These are some of the children from the Yombarad Railway community, one of many poor communities hidden in Bangkok. Their living conditions are forcing them to work illegally. Selling flower garlands at road intersections is one example. Many of them have no choice apart from saving that small amount of money and living off donations to survive during the pandemic, while families have almost no income.
ถ้าแบบว่ามีคนขายของอะไรอย่างเงี้ยค่ะหนูก็จะไปช่วยเขาแล้วเขาก็จะให้ตังค์มาพวกหนูก็จะออมกันค่ะจะไม่กินขนม
จะเก็บตังค์ไว้ทำอะไร
เก็บตังค์
เก็บไว้ทำอะไรคะ
เก็บตังค์ไว้เพื่อว่าเผื่อแม่เขาแบบว่าไม่มีตังค์จ่ายค่าบ้านแบบฉุกเฉินอะไรหนูก็จะเอาตังค์พวกหนูออกไปได้ค่ะ
เดือนนึงบางครั้งไม่พอแค่จะไม่มีตังค์กินเลยทำอยู่ที่โบเบเนี่ยใช่พี่ได้ข้าวกินเป็นวันๆถ้าโรงเรียนเปิดเงี้ยเด็กไอ้คนโต30เด็กเล็กคน20แล้วไอ้คนนี้อนุบาลหนูก็ต้องจ่ายอาทิตย์ละ200อนุบาลใช่อย่างเงี้ยมันก็ไม่พอนะเพราะค่าใช้จ่ายมันเยอะ
Apart from being at high risk of getting infected with COVID-19 due to their living conditions, according to the Foundation for the Better Life of Children, the pandemic highlights the underlying problems among children in dense and poor communities. Many of them have missed their education as their families are already struggling to earn income. Another underlying problem for these communities is domestic violence.
ครูจิ๋วคิดว่าความรุนแรงเนี่ยมันมี2ระดับหนึ่งคือความรุนแรงในครอบครัวเองที่เด็กเองหิวแล้วแม่เองก็หาให้ไม่ได้อะไรอย่างเงี้ยนะคะกับอันที่2ความครอบครัวระหว่างครอบครัวนี้เคยมีแล้วแต่ครอบครัวที่ไม่มีพอได้รับแจกก็อีกครอบครัวทำไมฉันไม่ได้มันก็จะเป็นความสัมพันธ์ระหว่างชุมชน
Meanwhile, in the Badview Railway community, 10 COVID-19 infections were found, mostly among family members. Many households have to keep their children at home to prevent them from contracting the virus. Some children, however, have to isolate themselves under a neighbor's care after their parents are sent for treatment in field hospitals.
ครอบครัวอื่นที่เขายากจนกว่าเรามีเยอะนะคนในชุมนี้ไม่มีกินเลยก็มีใช่เขาไม่ได้ทำงานบางคนขับ3 ล้อขับวินอะไรอย่างเงี้ยไม่ได้เงินเลยถ้าขับรถเขาไม่มีอะไรกินเลยไม่มีเลยค่ะเพราะว่าชุมเรามันก็หาเช้ากินค่ำอยู่แล้วใช่ไหมคะ
Apart from the children living in dense communities, many more are homeless in Bangkok and are infected with the virus. The Foundation for the Better Life of Children revealed that at least 10 people so far have contacted them for help. The foundation discovered, though, that there are still no facilities to take care of these children, especially when their infected parents are still in hospital.
So there must be something that we can do for these children. I mean,
definitely. And it's a sad truth here because many of them living in dense communities. So let's say when their parents have to go and receive treatment in field hospitals, some of the children some of them were only 3 months old and nobody could really take care of them. So many of the communities have been complaining that this is something that they have to handle themselves, but no one was there to actually give them some sort of protection for these children.
I mean, their life is hard enough without COVID-19, but this just add another layer, probably more than a layer, to their difficulties, to their hardship. Okay, now let's go to another side of the pandemic because Thailand trying to revive economy, especially the tourism sector. They have been planning, they have been talking about it so many times. The last project we heard is something called Sandbox, and then this third wave happened. However, Phuket will still open to fully vaccinated COVID-19 free foreign tourists without quarantine. The Tourism Authority of Thailand will proceed with its plan to attract foreign tourists to the resort island of Phuket without compulsory quarantine starting July 1st this year, with flight promotions as an incentive. The plan offers the first quarantine-free option for international arrivals in Thailand since the pandemic started last year to help the crippled tourism industry. The TAT aims to attract 129,000 visitors to Thailand in the third quarter of this year through the Phuket Sandbox project, where fully vaccinated tourists who have tested negative for COVID-19 can visit Phuket for a minimum period of 7 days before traveling to other provinces with airports. For interprovincial air travel, the TAT plans to cover the fares for one-way tickets priced at no more than 2,000 baht, while further details are still under discussion. That is a lot of incentive. The project will focus on attracting tourists from long-haul countries such as the United States, EU countries, and the United Kingdom, which, according to the TAT, will allow their citizens to travel abroad from this Monday, May 17. Discussions are also underway for travel from Phuket to nearby areas, while Bangkok, Krabi, Phang Surat Thani, Chiang Mai, Chonburi, Buriram, Phetchaburi, and Prachuap are expected to open for quarantine-free visits following the Phuket model in October. So it's another sector of the society that really heavily affected because this sector really relied on foreigners. It's and the third wave is hurting them really hard because like before when the third wave hit, Thai people was starting to traveling around, taking vacation and spending money on some hotels or beachside resort and things like that. But now, with the third wave, people just have to stay home.
Definitely. And the big question is, when can we travel again for Thai residents? Because even though the TAT is moving ahead with the attracting of foreign tourists into the country, but the problem is, when can we actually control the spread of COVID-19 so that people can freely travel, just like the end of the first outbreak?
Yeah. Definitely.
Yeah, and now let's move on to another side of COVID-19. There has been speculations that measuring oxygen saturation can be one of the indicators to determine whether you're infected with the coronavirus. We don't know whether it's true or not, so let's find out more in this report by Kun Kitipat Chinsukji.
COVID-19 has affected millions of people over the past year and a half. One thing that is quite clear is that the virus attacks the lungs of the infected, causing many to exhibit symptoms of severe pneumonia and, in turn, low blood oxygen levels. Besides professional medical equipment seen in hospitals used to measure oxygen saturation, in recent months, pulse oximeter and smart watches with oxygen saturation tracking functions have become a way for many people to monitor their own health. A medical expert says, however, that the pulse oximeters can only show if oxygen saturation is low and are not the best way to determine COVID-19 symptoms.
The pulse oximeter is not the best way to tell about the COVID-19 situations. It's only good to detect is anybody having low oxygen in the blood. As of, they can show low oxygen saturation, or medically we call hypooxygenation, low oxygen concentration, something like that. If someone have COVID-19, but the disease hasn't affected the lung so much, the patient may not have low oxygen saturation. His oxygen level could be into the normal range, but when the lungs start getting more and more damage, then oxygen start getting lower. That means if anybody have low oxygenation, usually the disease process is quite advanced.
Although there are some similarities between a pulse oximeter and a smartwatch with an oxygen saturation tracker, you cannot rely on its measurement as there are many factors involved.
Pulse oximeter medical grade is designed for checking at the tip of fingers with high accuracies. But for the arm watch with oxygen saturation, its main has not been tested for many circumstances, which in some circumstances may not be used to replace standard pulse oximeters. If the patient have poor circulation, have partial obstruction of the blood vessel, or have low blood pressure, pulse oximetry could be inaccurate.
Normally, oxygen levels should be above 96% and can vary related to the oxygen source, lung condition, and circulation. Someone could have 99% or 100% saturation. Dr. Surasit said that people with chronic diseases such as obstructive pneumonia, obstructive pulmonary disease, chronic obstructive pulmonary disease or COPD, or other chronic lung diseases could have a baseline lower than usual, around 93% to 95%. So, the best way to check if you are infected with COVID-19 is still an RT-PCR swab test. But if your home oxygen saturation reading is lower than 95%, call your healthcare provider. Reported by Kitipat Sukhjit for Thai PBS World.
Okay, and that's clear. It cannot really be an indicator that you get infected. But if the level of the oxygen saturation is low, there's definitely something wrong. Either the thing itself wrong or something with your health. So just contact your medical provider.
Definitely.
And that's all the news we have in this edition of Thai PBS World tonight. Just check on our website, www.thaipbsworld.com, for more news. We have so many things to talk about on there, not just COVID-19. We also have exclusive column about Myanmar as well, and many, many other interesting topics. We also have YouTube, Facebook, Instagram, TikTok, and Twitter.
And that wraps up tonight's edition of Thai PBS World Tonight. Thanks for watching. Stay safe. I will see you tomorrow. สวัสดีค่ะ
สวัสดีค่ะ